I'm Dr. Sushil Tandel, neurologist from Bombay. I'm attached to various hospitals like Bombay Hospital, Bhatia Hospital, Holy Family, Asian Heart and Railway Hospital, Western and Central Railway Hospital. Today I'll be talking on epilepsy, which is a common neurological problem, and there are a lot of misconceptions about epilepsy, and according to me, epilepsy is a treatable condition and it can be well controlled with anticonvulsants and with a regular follow-up with the doctor and understanding of epilepsy to the patient and the relatives and the caretakers. There are two types of epilepsies. One is the primary epilepsy and secondary epilepsy. Primary is the idiopathic, where you do all the investigations which are normal, whereas in secondary epilepsy you find a cause for the epilepsy. What do you mean by seizure? Seizure is a single unprovoked convulsion which is can be caused because of various causes, but when you get a recurrent episodes, that is called as epilepsy. So epilepsy is a recurrent convulsions unprovoked because of sudden derailment of the neurons of the brain. Primary idiopathic epilepsy are of three types: focal or partial epilepsy, complex partial seizures and generalized epilepsy. In focal or partial epilepsy, where there is only tingling numbness or focal movements of one limb, is called as focal or partial epilepsy, where there is no loss of consciousness. Second is complex partial seizures, where the patient is in altered sensoria and he has some automatism, lip smacking, finger movements. So this is called as complex partial seizures, mainly arising from the temporal lobes. Focal epilepsy arises from a focus in the brain. The third type is a generalized epilepsy, where the patient loses their consciousness and the patient is not aware about the convulsion. And there are various types of generalized convulsion like tonic, clonic, tonic-clonic, myoclonic, absence, or tonic seizures. These all are the types of generalized seizures. The common causes of convulsions are, according to the age, the child age group, when the child is born, it may be because of birth asphyxia, hypoglycemia, birth injury, kernicterus. When they are in the adult form or adolescent, they are because of idiopathic epilepsy, adolescent form. When in the adult, again they may be because of idiopathic epilepsy. In cases of older people, it may be because of brain stroke, brain tumor and degenerative brain disease. But the common cause of convulsion irrelative of the ages are head injury, intoxication, infection like meningitis and encephalitis, which can occur to any ages. Alcohol is mainly common in the middle age group, and that also can cause convulsions because of alcohol withdrawal or alcohol intoxication. These are the various causes of convulsions. When the patient comes with a convulsion, we have to find a cause of the convulsion. Why he got a convulsion? For that we do some blood tests like blood sugar, calcium, electrolytes. These are the blood tests, and sometimes when the patient is on some drugs, for phenytoin, carbamazepine, then we do the levels of the drugs. That is called a therapeutic drug monitoring. Another test which we do is the EEG. We put the leads on the scalp to record the EEG, scalp recording called EEG, electroencephalography. There are some imagings of the brain which are done called as CT scan brain, MRI brain, called as epilepsy protocol specific for the epilepsy. These are the common tests done when the patient comes to you with convulsion. When you see a patient convulsing in front of your eyes, what should you do? First, make the patient comfortable, make him lie down on the floor, don't overcrowd the patient, loosen his clothes, ventilate the room by putting a fan or AC on, make the patient lie on one side so the saliva comes drooling outside, it doesn't aspirate into the lungs. The tongue falls on one side so the patient can ventilate or take air properly. and see that no sharp objects are near the patient, so it doesn't harm his body. When a patient gets convulsion, everyone is in a hurry and everyone is confused what to do and what not to do. But I personally feel we should avoid putting a spoon in the mouth, because that will break his teeth. Don't put some onion, crushed onion on the nose, it makes it suffocating. Don't smell the chappals because it can cause infection. And don't crowd near the patient, because the patient has to breathe, has to ventilate. He has to have some space to breathe. Loosen the clothes of the patient. A person can get single episode of convulsion, and it can be a first and last in his life. So if it doesn't recur, then it doesn't become an epilepsy. So some convulsions are situation related. For example, hypoglycemia. When the sugar goes down, they get convulsion, and if you correct the sugar, the convulsion will not recur. Or a metabolic cause, hyponatremia. Sodium goes down, and you correct the hyponatremia, and the convulsion will not recur. So they are situation related, and sometimes a fever with a heat stroke. When the fever is high, they get convulsion, and if you control the fever, and then they will not develop the convulsion. So they are called situation related convulsions. If they doesn't recur, they will not fall into a category of epilepsy. Single unprovoked seizures may not require treatment for a lifelong, whereas an epilepsy who get repeated attacks of convulsion, they require a minimum treatment of 2 years, consecutive 2 years, and if they don't get a convulsion for 2 years, then you can gradually taper off the anticonvulsants gradually after doing the blood test and EEG and MRI. Now coming to the management of epilepsy. When any patient comes with epilepsy to you, then the first thing you have to counsel and take confidence of the patient and the family members that you are starting the treatment for epilepsy. And the patient should take regular medicine, number one. If the patient gets convulsion again and again, then you may have to add 1 or 2 drugs to control the convulsions. If in spite of multiple drugs, if the convulsions are not under control and the patient has got a focus on the MRI, then the patient can take help of a epilepsy surgery. There is another thing called as vagal nerve stimulation, where they stimulate the vagus nerve to decrease the frequency of convulsions. Sometimes you can take a dietary advice called ketogenic diet to control the convulsions. And the main standby of epilepsy is you have to counsel the patient and the family members what is epilepsy and how to fight epilepsy. Epilepsies are of 3 types. One is a primary epilepsy or idiopathic epilepsy, where you try to find out the causes. The cause is not found. Second is a secondary epilepsy, where you do investigation and you find out the cause for the convulsion. And third is a cryptogenic epilepsy, where sometimes when you do some investigation, you get some answer. If subcortical dysplasias are seen on 3 Tesla MRI, which were not seen before, and they were labeled as idiopathic, which because of the sophisticated investigation, we could find out some, we can get some causes of epilepsy. That comes into cryptogenic epilepsy. Now coming to clinical types of seizures. Number 1, called as a focal or partial seizures, where there is focal movements or jerky movements of one part of the limb or tingling numbness in one part of the body, called as focal convulsions, where there is no loss of consciousness. Number 2 is complex partial convulsion, where there is altered sensorium and the patient has got automatism like lip smacking and automatic movements of the fingers and fiddling with the fingers. The third type is, clinical type is generalized convulsion, where there is total loss of consciousness and the patient is not aware about the convulsion. And the types of generalized convulsions are tonic, clonic, tonic-clonic, absence, myoclonic and atonic seizures or drop attacks. People with epilepsy can have a normal life, they can marry, they can have kids, they can have a family. social and professional life if they take proper medication and follow up regularly with their doctors. Epilepsy is treatable. All the best for epilepsy patient from Dr. Tandel, Mumbai.